Nursing is the care of patients that are experiencing health disruptions or just really in need of information about how to stay healthy. Our mission is certainly to provide the best quality care so that our clients and patients remain healthy.
Definitely nursing as a profession is grand. You have the opportunity to assist individuals that are in need of your care. I mean, it's a profession where you feel, once you've completed your 8 or 12 hours of work, that you've made an impact on someone's overall well-being.
We probably have in our pre-licensure program that are actively doing their, we call the clinical 3-year rotations. We probably have about 150 students. And then there's 200 or 300 pre-nursing students that are doing their qualifying courses.
For me, as a former alumnus, it has actually changed from how I recall, but I've enjoyed it immensely. We have tried new ways of learning where we have active learning. The students are engaged in their learning versus that standard, lecture presentation.
There's 50 of us in the class, and I haven't met anybody yet who doesn't like what we're doing. Everybody comes to class excited. We're all having a really good time, especially in labs and clinicals.
Well, in the pre-licensure program, we prepare them to be nurse generalists, we call it. So they have a taste of all the different areas that nurses can work in during their schooling. But as far as an in-depth education, let's say for an example to be an OB nurse, they really would get that once they got the job in an OB department.
We do pretty much any procedure that a patient out in the hospital setting would require. We look at IV, intravenous starts. We also look at medication administration, inserting Foley catheters, nasogastric tubes. So we get hands-on experience, for the students, which is really great because they can actually, once they're in the lab, they can practice those procedures there before they actually will do it on a real-life patient.
Like today we're practicing inserting a nasogastric tube, and so it goes in your nose, comes down your throat to your stomach, and we're practicing that on dummies, and then we have the option to practice on each other as students.
First thing is to drape the mannequin with a towel, and we need to make sure that a basin's in place in case he's going to have anything that he's got to spit up.
Got tissue for tearing.
Yep. And also, before we start the procedure, have the patient blow their nose. We're going to palpate the abdominal area for any distension or tenderness. And we're also going to auscultate, which just means to listen to bowel sounds to make sure they're active, which basically makes we just make sure they're normal. And before I put it in, I just have to make sure his neck is hyperextended back. We insert it. The patient's going to tip his head forward. And at this point, the patient would start drinking water, and with each swallow, I would advance the tube down at least an inch. So it would be pretty quick because they're just a continuous suction from the cup.
Every semester, our students have clinical, we call it. And it's where they are with a clinical instructor, and there might be 8 to 10 students in that group, and they go to various different clinical sites.
So we do make sure that the students are fully prepared, but they always have satisfactory comments that they have been properly prepared by Ferris to function as the nurse on the job.
I feel prepared, but it's also nerve-wracking. It's a lot different than working in a lab on a mannequin that has no heartbeat. But when you go to actually touch a real person, it's more nerve-wracking. But your clinical instructors at the clinical site, along with the staff nursing, will help you come over that slight fear you have. And then once you start to do it, you become more comfortable.
Our job placement's very high. The thing is, as a student, we always tell them they can't want a specific area at a specific shift because that might not happen in the beginning. But eventually they will get to that area maybe that really, really excites them.
To learn the information that I'm learning, but definitely the clinical site is really a lot of fun. That's where you get to actually do the real situations, the real deal, and you get that thrown in there. Like the third week of nursing, you're actually on the site doing what you're supposed learning in lab, which is really cool. It's not like any other program where you have to study it for like 4 years and then do an internship. Like we're doing it as we're studying it.
I would suggest nursing to any students out there interested in the healthcare field. It's a lot of fun. You're going to love what you're doing. Classes are great.
I would recommend it. It's definitely a challenge, but it's very rewarding, and you learn about medicine quite quickly. So, you learn a lot about conditions and medicines, and interventions to help improve certain conditions. And if they love to help people, then I would recommend it. I mean, I haven't regretted it since I switched from pre-pharm, so I enjoy every day I'm a student.